All right, thanks very much for waiting, everybody. Sorry about the late start to the session. We're going to begin now. So this session is entitled Mental Health, Austerity and Capitalism. In the printed programme, it was truncated just to mental health, but we are focusing in a little bit within that very broad area. My name is Ed Lewis. I'm an organiser and a campaigner with a background in teaching. And I was asked by World Transform to facilitate this session, and I'm very glad to do so because it's obviously a very pressing and significant topic. And we are going to be assisted in our discussion tonight by our speakers John Cheetham and Lisa Rossetti. I'll introduce them properly in a moment, but we're very grateful that they've come to talk with us tonight. In terms of the discussion we're going to have, just to note that this is going to be, after we hear from the speakers, a participatory discussion. I've got some questions which I'm going to be putting to you, the audience, so as to kind of maximise opportunity for people to engage with the issues and speak at least in small groups, and then we'll open it up to some wider discussion. And of course, we should note that this is a topic which can be extremely sensitive for some people, and we encourage you to be mindful of that, mindful of the need to be sensitive to others, and indeed also to yourself if you're talking from a personal perspective. Although we obviously welcome that, and it's an important part of the discussion. So, with that being said, unless there are any other preliminaries I've missed, I'm going to introduce our first speaker, which is John Cheetham. He is a member of Psychologists for Social Change, which is a campaigning group. Some people might have heard of Psychologists Against Austerity. It turned into Psychologists for Social Change. And John is a senior clinical psychologist in the NHS with experience in a wide variety of contexts as a practitioner, and he'll be talking tonight, drawing on his experience as a practitioner and a campaigner. So, over to John.
Thanks, everyone. Thanks. Just to give a bit of context about Psychologists for Social Change, so as I said, we're a campaigning organisation and kind of started around 2014, 2015, really with the onset of all major political parties taking the approach of austerity as a way to run public services, and we felt very strongly as clinicians that was not the way to go. So we're very glad to be saying things seem to have shifted, certainly in the Labour Party recently. And the sort of talk that I've written up today is based mostly on our briefing paper written in 2015 about austerity ailments, as we call them. I'll sort of explain what that is a bit more, but also sort of drawn in a bit from my own research and things. So I've written down here far too much for the 15 minutes, I think, that I'm due to speak for. So I'm sure I'll come back to things as we go on. Also a bit of a disclaimer. So as I was writing this, I found myself feeling that a lot of these statistics and all this information actually felt quite overwhelming for me to be reading and to putting it down on paper. So I kind of, and practicing the talk as well, I felt at times really quite emotional thinking about the facts of what this is, so forgive me if that sort of comes across a bit as well. So since 2010, there's been an ever-increasing programme of cuts to public services and welfare, and this has disproportionately affected the most vulnerable people in our society in the name of austerity. Ideas like the nation has maxed out its credit card, austerity is a painful but necessary medicine, have all been used to frame these policy choices as unavoidable and morally right. Psychologists for Social Change argue these cuts are both avoidable and immoral. As psychologists, we're often in a position to see the effects that societal and economic conditions have on people's lived experience. We see through our work how essential it is to take into account the psychological costs of austerity for individuals and communities. And we see clear and robust research evidence linking austerity policies with damaging psychological outcomes. Yet these facts from the evidence base are so rarely discussed in media and policy debates. It's one of the reasons it's so important to have forums like this. The emotional well-being of societies and individuals is determined by multiple factors that interact with each other. These include economic, societal, familial, psychological, and biological influences. Mental health problems are understood as an individual level response to difficult or extreme life circumstances. Work at epidemiological levels shows robust evidence for the effects of social inequality and poverty on physical and mental health and well-being, regardless of the cultures being researched. The number of people in a society with a diagnosis of mental health problems is strongly associated with a range of these social factors. Since the implementation of austerity policies, we know that poverty has increased and social inequality has increased. Associated with this, statistics show an increase in diagnoses of mental health problems. There's been a rise in antidepressant medication prescriptions. GPs are reporting increasing numbers of mental health appointments. There's been a rise in male suicides, with suicide now being the leading cause of death for men under 50. Since the financial crisis, suicide rates have increased in European countries that have adopted austerity policies, but not in ones that have protected their welfare state. I'm just going to skip that section. We see through the ways that mental health services are structured that we ignore too often the psychosocial, things like the impact of the economy, the way that we think about work. All of these things have an impact on our mental health. Quality of housing, all these things are essential in having good mental health. But services we don't think about that in the way we are structured, we don't think about that in the interventions that we offer. We're very much focused on the biomedical, on treating people with tablets or with a course of therapy, which is sort of then framed in a similar way to the biomedical. And there was a recent report from the United Nations Human Rights Council, literally published, I think it was only about 3 or 4 months ago, saying that the way that we run our mental health services in this way, it promotes the abuse of human rights. That actually people do not have access to evidence-based mental health care because we're so structured within a biomedical framework and we're ignoring those psychosocial level interventions that we might be providing. In the current environment of austerity, the NHS has become used, or the way that notes are used in the NHS has become to really focus managers' attention on cost. We use notes to prove that we're meeting targets. The way that the organisation's business objectives are achieved is looked at through the way that notes are written up. We have to tick the right boxes in the right places so that the right people know about the work that we're doing. And all of that limits the work that we do. It limits it to things that we actually get the funding for to do our jobs. And the impact that has on the way that we then work with individuals is it promotes a dehumanising process. It ends up where staff teams develop cultures of seeing the health condition but not the person. So there's all this work that's happened looking at how people get spoken of as the kidney in bed 9 or the schizophrenic in room 12 and not John or Ed or Lisa. So we have the evidence. The evidence tells us what we need to be doing, but we're not doing it. Partly, as the UN have said, because the systems in place promote only one kind of intervention. When Psychologists for Social Change did our briefing paper in 2015, we looked at the research evidence base available then and sort of named what we saw as 5 austerity elements, these things that were being engendered by austerity that promote bad mental health. These things were humiliation and shame, fear and distrust, instability and insecurity, isolation and loneliness, and being trapped and powerless. I was going to talk briefly about some of the stats behind all that, just to kind of evidence that. Considering the first of them, humiliation and shame, there's been a 68% increase in hospital admissions for young women and a 26% increase for young men under 17 using deliberate self-harm as a way of managing their distress in the last 10 years. The background to that is the increasing stress relating to body image and social media So these things are very clearly social level issues. Our society is promoting the shaming of young people in order to promote beauty. At the same time, 72% of consultant psychiatrists in children and adolescent mental health services say that NHS services are inadequate, and cuts to the numbers of inpatient psychiatric beds has been taken to levels deemed unsafe by the Royal College of Psychiatrists. The second austerity element, fear and distrust. Austerity relies on the politics of fear and distrust, and we can see it through the rhetoric that is being increasingly used. The fact that Donald Trump is president of the USA, the platform he used to win the election, and his remarkable use of language about North Korea, shows such clear and purposeful use of generating fear and distrust of others in order to create divisions in society and garner power. We see the same use of language here in the UK, with politicians promoting messages of fear and distrust towards people who use public services. The Department for Work and Pensions has been reprimanded by both the UK Statistics Authority and the Parliamentary Committee for Work and Pensions on the misleading and ideological use of statistics to promote negative views about benefit claimants, including disabled people. This is a deliberate strategy to undermine popular support for the principle of social security. Over the past 30 years, there's been a 20% reduction in people who think that the unemployed are deserving of the support they receive, and people are more likely to think that benefit claimants are lazy and don't deserve help. Societies that are less trusting also tend to be less equal and have higher rates of mental health diagnosis. High levels of distrust are associated with an 80% increase in overall reported poor health. People who live in neighbourhoods that have high levels of distrust have increased rates of diagnosis of all mental health problems, including psychosis and depression. Policies that increase distrust within and between communities are therefore poisonous to both community cohesion and individual mental health. Looking at the third austerity element of instability and insecurity, we must take into account the security of work, of income, of housing. Under austerity, work has ceased to be a guarantee of stability. This period of austerity has led to in-work poverty outnumbering out-of-work poverty for the first time. An increasingly precarious workforce finds itself moving back and forth between insecure work and insecure benefits, with sanctions underpinning an increasingly punitive system. The cost to mental health of this kind of insecurity is well established. The fourth austerity element of isolation and loneliness relates to people's capacity to feel connected with and supported by others in their community. Community resources for people at risk of isolation and loneliness have been drastically cut as a consequence of austerity. By 2018, local government will have had a 50% reduction in central government funds compared to 2010, leaving them without the ability to adequately resource libraries, Sure Start centres or social care for older adults, people with learning disabilities and people with mental health problems. The people most at risk of becoming isolated are then the ones who are most affected by these cuts. The final austerity element, being trapped and powerless. One of the main effects of austerity has been to reduce people's choice. Cuts to legal aid have meant that many people are without legal help in crucial areas such as housing, family, debt and benefits. Unsecured debt is now at its highest rate since the 2008 crash. People on zero-hours contracts are relying on credit cards to balance out their incomes when they live with precarious and insecure employment hours. Women too are disproportionately relying on credit to see them through to the next payday, as employment associated with female work with work that is called female is less than the salary given to work that is thought of as male. Other forms of entrapment are more concrete. Funding for domestic violence shelters has plummeted since 2010, leaving hundreds of women and children with literally no safe place to live and no way out. 2 women a week are killed in the UK by current or former partner. That's a statistic that gets me. Every time I read 2 women a week are killed by their partners. And they're at most risk of being killed when they try to leave the violence. With no safe place to go, government action has directly led to the death of scores of women and the entrapment of hundreds more. This clearly has long-term implications for these women, but also for their children who grow up in violent homes. Witnessing domestic violence is known to cause children to develop disturbed relationships, with high rates of violence towards themselves or towards others as a characteristic of their relationships. future. So it's pretty clear we're not in a good place, even before austerity started. But how can we make things better? Where do we go from here? As well as outlining those 5 austerity elements in our briefing paper, we looked at 5 markers of a healthy society. The markers that we named were agency, security, connection, meaning, and trust. What do we mean by those things? By agency, we're talking about a sense of mastery over your world, a sense that you have choice about how your world looks, you can influence it, it's not all directed by other people. Security is about your housing, about your income, feeling safe in your home and your community, knowing that the wolf is far from the door. By connection, we talk about attachment theory. We talk about the sense of a positive impact of feeling connected with other people. This extends to a sense of community and how that has a positive impact on our individual well-being. Having a sense of meaning in one's life. The Tories are particularly very keen on talking about work as the thing that you need to have a meaningful experience of life. But work can also negatively contribute to your mental health. It's all about the quality of your work. Work needs to provide something that's of a benefit for you, as well as the cost of the outlay of going to it. It has to be worth the income, not just monetary terms. But also it's about relationships. It's about meaningful occupation outside of work. It's about spirituality and civic participation. Finally, trust. Societies which are more equal and socially cohesive have higher rates of trust. People living in more trusting societies have greater levels of subjective well-being and lower rates of mental health diagnoses, and more positive social and health outcomes. Trust facilitates the development and maintenance of social capital, social bonds, and networks. Increased individual trust and community cohesion are mutually reinforcing. Trusting individuals generate communities which have stronger bonds within them, and which can bridge links between groups more easily. These trusting relationships can nurture us and are the foundation for good mental health. So, just to close my part of the talk, I guess the sort of key points to hold on to from this. Social policy needs to explicitly support the development of a more equitable and participatory society. This will facilitate individual well-being and resilience and make stronger communities. Policymakers need to assess the psychological impacts of social and economic changes that they implement on the national level. Our social security system should empower and support, not punish or ignore people in times of need. Public services need to use their duty to uphold people's human rights to increase their focus on preventing distress, improving citizen participation and social justice. Creating the conditions for well-being and resilience directly improves physical and mental health outcomes, so saving resources and reducing suffering. Mental health isn't just an individual issue. To create resilience and promote well-being, we need to look at the entirety of the social and economic conditions in which people live. And finally, we know that healthy communities can't be created from the top down. So I invite you all, for the rest of this evening, to be thinking about what small everyday acts we can all be doing to promote those 5 markers of a healthy society. Thank you.
Thank you, John. That was fantastic. I'd now like to introduce our second speaker, Lisa Rossetti. Lisa, like John, I should have said, is a Momentum supporter and Labour member. Lisa has worked for nearly 10 years in the community as a story and writing practitioner in Cheshire, working with people with adult mental health problems, working with adults with mental health problems, and also people recovering from drug and alcohol addiction, and people experiencing homelessness. Lisa is going to talk to us about what she's learned from those experiences, and I think share some stories and case studies as part of that. So, over to you, Lisa.
So thank you, Ed, and thank you, John, for a great talk, and thank you all for coming. I learned the thank you from Jeremy, actually. See all the thanks, everybody does something. I don't know everything off by heart, so I will be reading from notes. I work creatively with adults, as Eddie said, and one of the poems that I use, I'm going to just share with you now. See how it just lands with you. This is an excerpt from a poem by Stephen Levine, and Stephen Levine is American who works with bereavement. He works creatively, as I do, with stories and poetry. This is an excerpt from one of his poems called There Are Words in Us. There are words in us that don't know how to get to the surface. Words hidden in our marrow, afraid to show themselves, afraid the world will come apart if they are spoken. So for me, that's quite powerful. Would you agree with that? Yeah. So I just want to start with just a couple of, three quotes from three people whose work I admire. The first is George Monbiot, and he said, "What greater indictment of a system could there be than an epidemic of mental illness?" And the second is from Owen Jones. "The insecurity that defines the lives of millions of people does not represent a flaw in the system, it is the system." And finally, a quote from, is he Professor or Dr. Peter Kinderman? You would know him, he's probably a colleague. I think he's a professor. And I came across Professor Peter Kinderman in a Future Learn course. He was at the University of Liverpool then teaching psychology. And this is what he says. He says, "The evidence is overwhelming. It's not just that there exist social determinants of mental health. They are overwhelmingly important." And Professor Kinderman taught me a lot about the psychosocial model that John was speaking about. So stigma and myths abound. Mollycoddling, scroungers, shirkers. Just pull yourself together. Stand on your own 2 feet. We can give you the skills. I work in community as a biblio-poetry practitioner of people with mental health problems, and I also support the recovery movement and work with the homeless as well. I'm and I have to say this for the socialist environment, a non-fee paid, in other words, voluntary for free, director of Lapidus International, which is a Words for Wellbeing organisation. Do look it up. Lapidus is lapidus.org.uk. We work creatively. My work is based on therapeutic principles. It has a model, a proven model. And I say these things because some people say, well, you know, just coming from the point of white female privilege, going along with a nice little poem and making everybody feel okay, you know, and it patches up the system and off you go. But actually I have seen some real transformation happen amongst the people that I work with, and I'm absolutely about people with problems in their lives, people, not service users, you know, clients, people having a voice. I'm really about that, so that is what I do. The recoverist movement, I don't know if you've come across that, but the people in recovery. Clive Parkinson from Manchester Metropolitan University and Alistair Sinclair, who is a friend, wrote a recoverist manifesto dispelling stigmatising myths and legends associated with the condition, challenging all the current cliched misconceptions. And they identify, for example, addiction and recovery as a civil rights concern. So I think that's a very interesting point. So I've been on something called a recovery walk. I don't know if any of you have been on one. It is around the UK. It's international actually, but in the UK, in Chester where I live. And people recovering go on these walks for solidarity. And also to show people something, because a very significant banner was held up at the last recovery walk I went on, which said, "Don't believe the lies we do recover. So for anyone who is in recovery now, then, and most of us have some kind of recovery journey, even if it's from consumerism or Facebook, so not to belittle, anyone who's really suffering challenges at the moment, but I have this is quite a modelling co-production, my talk, because I have what I call a rant poem from a very dear friend who is a mental health nurse. She's a practitioner, a learning practitioner for mental health. She's a lecturer in mental health. And she has written, and even if that's all I achieve in my 15 minutes, I think it's worth listening to, because I said, could I turn it into a poem and, recite it to you. So this is Liz, my friend, this is her rant poem. Yes, there are cuts to services, huge cuts, meaning people do not get the support they need at the time they need it. We have self-help notions, bastardized and hijacked by a conservative mindset. We give you the skills to help yourself. They took the ethos of recovery and used it as a Trojan horse to force further cuts, to slash teams reducing services, while commissioners set hoop-jumping targets to evidence efficacy and denote failure to justify further cuts based on, as always, short-term accountancy. Bed closures and what's a PICU? You know what a PICU is?
Psychiatric Intensive Care Unit.
Psychiatric intensive. So bed closures and PICUs, miles away from home, inadequate, burnt-out CAN services. We have never had such a rich-poor divide. We live in a society that measures success by material possessions and Instagram likes. A nation dumbed down with a collective pacifier that is social media. Large groups of folk scapegoated as scroungers, as lesser people, benefit sanctions which actually cause homelessness. Disenfranchised, marginalised people unable to self-advocate, living under the myth of free will and choice. God, it's so frustrating.
Please give a round of applause for Liz. Amazing friend, I tell you. So, and by the way, if I'm shaking, so I'm not nervous, I just shake.
So to feel and be felt by other feeling people, this is what I try to achieve in the work that I do. I work with poetry, as I said, and stories. I have people writing for themselves for the first time, but the major goal that people tell me they want to achieve when they're in a session with me, and I'm trying to create this micro community of creativity, really, and connection. And the thing they want to achieve the most is to have the confidence to speak in a group. That happens again and again. People say that's what they want to achieve. And it's quite tragic that people would have so much anxiety that even when they're in their peers, they feel so isolated and disconnected, perhaps even from themselves, that they cannot speak in a group. So that whole group ethos is very, very strong in the work that I do, and does help people because they do achieve it, and then they've achieved something that they wanted to. So it is a strong point in the work that I do. I attended an all-parliamentary group, a roundtable discussion in the House of Commons last year, and that was on well-being and social deprivation. There's just a couple of points that came out for me I thought was very relevant, which various incredibly well qualified and elevated people talked about. Baroness Ruth Lister, Emeritus Professor of Social Policy at Loughborough University, she said, well-being adds new dimensions to the framing of poverty. The experience of poverty is a psychosocial dimension with unmet needs. The impact of othering, shame and deprivation is acute in highly unequal societies like our own. So I hope that's what you were saying, John. Daily chronic insecurity leads to highly bounded agency.
And also, we may say that people have a right to culture, a place of beauty, and a right to beauty. So that, again, to me is interesting because, you know, cuts, austerity, and the neoliberal agenda are commodified. You know, they're making art commodity. It's not participatory anymore. It's not community-based, and it's highly expensive. It's only for the elite. So, you know, we can reclaim a lot of ground through arts. We definitely can. So what I do see in my work, and again, John has mentioned all these things, anxiety and stress. I had funding from the council, and I had one young lady who, when she knew that I had funding from the council, and she was in one of my groups, she said, "You're not from the council, are you?" She was so frightened. She was being checked up on. She was a single parent with 2 children. Unfortunately, the council came to audit. I know they have to, but they had to come and audit the quality of what I was doing, which they didn't understand, by the way, and chose her to question her about everything. I was like, no, please, not Charlotte, please, no. And I could see her going into a mental spiral after that because it was too much for her to be questioned so closely by the council. And she did take her life actually a couple of days later. So, I mean, to me, that was absolutely devastating. The first time I had it wasn't proven suicide, but she was found in the bath by her children. So it's just, you know, I don't think that's it. I don't blame the council, but I'm just saying that because they have to do that, but she was insensitive to the needs of this person, and that is what happened. So. But yeah, I get your point, and perhaps we'll return to that. So I see social anxiety and low self-esteem. I see poverty and social inequality. I see shaming and othering, housing problems. I mean, to be told you should set goals for your learners to turn up on time. And I'm like, yeah, you know, if you're homeless or, you know, you live in chaotic housing, or it's really, it's so insensitive that there's no understanding, is there really? So, I see isolation from community, social networks and family, and I see political isolation with no participation in citizenship. So we do need to move from this disengaged civil self and community self to the connected self. Well, how much more time have I got? Oh, 3 minutes quickly. I've worked with a charity called Save Family. These are chaotic young adults and parents. They grow up in deprived areas like Stoke, like North Wales. Those patterns of fostering, which they then replicate. They have very low self-esteem, they have overwhelm. A lot of this has come from austerity, from cuts, from sanctions, from benefits, sanctions and so on. Poor housing, communities that have fallen prey to drug, the drug culture and so forth. And of course, all these young adults would have had their formative and teenage years doing years of austerity. So that's impacted on them, I believe. I just want to just say something, if I can just find it, hopefully. Please give me another minute or so. It's just, I want to tell you about Freddie, not his real name, but nearly his real name. He was a participant, one of my creative writing. He loved writing. He is a creative man. He's a musician, a guitarist, and he loved writing. He discovered a new skill, and he was very good at it. Not that I judge, actually, just like expression. And he, when our local drug and alcohol services, the tender went out and our NHS lost it. And it went to a private company, which will remain nameless. Unless you come from Chester, then come see me privately. But he said, because I asked him, would he mind me sharing his experience? And he said, I turned up for a weekly appointment with my key worker, and at meeting we agreed to an 8-week timetable to reduce my alcohol intake incrementally, so it would be 0 at the end of that period, 8 weeks. This is a lifelong alcoholic. A week later I returned feeling very positive. before I could share my good news with my key worker, he came to the point and said my time as a client was over because my progress was too slow and resources, i.e. staff time, could be better spent on someone else. This time I was so stunned I forgot about the previous week's 2-month plan. 2 weeks later I received a phone call saying my key worker had acted incorrectly and I could continue to run my guitar group. I declined. Some weeks later I went cold turkey, so he just did it himself basically, and been sober ever since. Just cutting down on that. Would I recommend this service to family or friends in need? I'd have to say I have to, because they are the only agency in Chester, but I would warn them that anyone going to, they would be on a timetable not set by their needs, which is what we're used to in the NHS, right? Patient need. Not set by their needs, but by statistics needed to demonstrate the effectiveness of that agency. So this is what's happened to drug and alcohol services in Chester, probably all over, all country. And the other thing is, if you come to the end of your 8-week drug and alcohol recovery program and you haven't achieved it, they wave goodbye to you and do a big tick that you completed 8 weeks. And then when you inevitably return, because you still need the help, you become a new client. So they get an extra number in their statistics. So by providing inadequate services, they are apparently improving their statistics. Wonderful. So, what do I feel we should need to do? I feel we should go towards strengths-based and community or peer-led working. It's a wonderful example in my town called Chester Plus. It's peer-led recovery. It's absolutely brilliant. Where you can get mutual aid to build your recovery capital. And we should take the building social and mental capital and resilience seriously, just like John said. We didn't liaise, by the way. And prioritise well-being of children in schools and altruistic contributions to social virtue rather than just get ahead, climb the ladder, competitiveness, so contributing together. And all government policies should be justified in terms of human well-being and the impact of those policies on well-being. And basically what we need to do is to invest properly in mental health. So thank you very much for this slide.
Thank you, Lisa. I expect a number of us feeling quite emotional after the talks that we've heard, and we've heard about some very difficult and very unpleasant stuff. Lisa mentioned the challenge that some people have in talking in groups, and so what I'm about to suggest, certainly if anybody doesn't feel comfortable to do that, obviously do as you will. But I feel like this would be a good opportunity for people to have a bit of time to reflect a bit on what they've heard in small groups of maybe 5 or 6. You probably want to spend a bit of time just kind of unpacking some of what John and Lisa have talked about. And then, if you're up for it, then the question that I wanted to pose first of all is, what do we think are the underlying causes of the prevalence of mental health problems in our society beyond just cuts to services, which is obviously very important, but there are some wider questions as well. So what do we think are some of the underlying causes of the rise in mental health problems in our society? And what I suggest is that we have a discussion that lasts for about 10 minutes or so, and then nominate somebody in your group who's prepared to feedback one or two of the points that people have made, and we'll have a discussion together, bring John and Lisa back in, and then after that we'll move on to thinking about, well, what do we need to do, how can we change things, and try and be a bit more positive. But I think it is important to think about why are things the way they are. So if you're happy with that, then get into groups of 5 or 6 or so and have a discussion for about 10 minutes. Okay?